Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. So glad that you could join us once again. Our guest this afternoon is Mr. Bret Miller. He's a cancer survivor and co-founder of the Male Breast Cancer Coalition. And he's joining us today to discuss his unique story and how genomic testing helped him to determine the best course of treatment for his breast cancer. He's also going to talk about his nonprofit organization and their mission to help spread the word that breast cancer does not discriminate. Welcome to Health Professional Radio, Bret.
Thank you for having me.
What is it that you do other than being the co-founder of the Male Breast Cancer Coalition?
I share my story to anybody that's willing to listen, to help other men feel comfortable with hearing the words, you have breast cancer. Because for most men, it's emasculating. It's kind of embarrassing to hear those words, breast cancer, because immediately you think pink, you think women, you think it, there's no way I have breast cancer. I don't have breasts. Well, everybody has breast tissue, and that's what it's affecting. So it's building the awareness, making sure that men know that although it is rare, it's, as I say, is 1% of all breast cancer cases. And roughly 2,500 are diagnosed every year. And of that, about 400 to 450 will die from it because they do not know that they can get breast cancer. So it's building the awareness and spreading the word that men, don't be afraid to touch yourself and get to a doctor if you found a lump in your breast, just like you would if it were testicular cancer or something else.
Now, you're in your early 30s now, correct?
Correct. Yeah, I'm 32 right now.
But when you were diagnosed, you were just out of your teens. You were 20 years old. You're a young man, and you're facing breast cancer. What was it like being that young and with, as you say, the stigma surrounding breast cancer when it's mentioned to a man, especially somebody coming right out of their teens?
Yeah, well, long story short, I was 17 when I first found the lump. I went to two different doctors within that year span of first finding it, and both doctors said that it was a calcium buildup. Fast forward 7 years. I was 24 when I finally I had health insurance for well over a year through my job, but I finally got time to go to the doctor to do a physical. I didn't have any symptoms or any feelings that I was sick or needing to go to the doctor for any reason. It was just one of those, well, I haven't been in some time, so let's just go. So I was 24 when I was officially diagnosed, and definitely hearing those words, it's breast cancer. Definitely a shell shocker. I didn't think it was something that would be possible, let alone something for somebody that young. And everybody's always asked, well, why wouldn't the doctors at the time of 17 think that it was breast cancer? Well, that was early 2000s. I highly doubt that any doctor at any given point at that time was thinking that a 17-year-old male has got breast cancer. So I don't blame them for any of it, or misdiagnosing or anything along those lines. It was just definitely an extremely rare occurrence. There was another 24-year-old male somewhere in Europe diagnosed around the same time. His was much later stages. But it was definitely just, at first embarrassing to hear those words. But meeting with my surgeon and him telling me, kind of making me a promise that if I'm willing to share my story, because he believes that me being so young, that if I'm sharing my story, it can help others, that he would, make sure that I get healthy again. So it was kind of like we had that agreement, and just hearing that just kind of made everything, all the stigma of, hearing you have breast cancer just go away. And I'm just another breast cancer patient, and I'm here to help others.
Once your primary care doctor, was it your primary care doctor that did the proper diagnosis initially? How knowledgeable was that doctor once they made the diagnosis about male breast cancer?
He really wasn't. So I went in just to go get a routine physical. They checked all blood work. They did, all the standard stuff for a physical. He was almost out the door before, and then he asked me, did I have any other questions for him or any other concerns? And that's when I brought up the lump. He turned around, he looked at it, and he looked straight at me. And he goes, let's get you signed up for an ultrasound. So within a couple of days, I was sent to go get an ultrasound at the women's clinic. And there they did the ultrasound. The doctor that's at the clinic does a triple take on the ultrasound of myself, and says to do a mammogram. I don't think that my primary care was very, he didn't know a whole lot for breast cancer. He was just your standard kind of doctor. He was not specialized in it at all. So from him, he got the ball rolling with scans, then set me up with a general surgeon that removed the lump at first, and he was the one that just called me the next day after removing the lump, saying it was breast cancer. He had not fully read the whole report, but would read it and get back to me in 3 or 4 days. That surgeon we did not use for the mastectomy and the following surgery. So, so it was a bumpy start at first on getting the correct doctors. But once I was officially diagnosed with breast cancer, of course, my mom, she took the reins on everything. Called that doctor immediately after, even earlier than what it should have been. Because once I got that call, I called my dad. I told him, I was like, I'm leaving one job. I'm going to the next job. I don't have time for mom to call and freak out on me regarding everything. So if you could wait until I get home from work, I will tell her in person. And he, of course, he's like, okay, it's a lot to hold in, but I think I can do it. 5 minutes later, my phone rings and it's my mom. But because of her being, a mom and protective, we were in meeting with that surgeon to get more information from him the next day, and then also meeting with other healthcare professionals. And my case got beeline to quite a few top doctors around the area. So that helped advance, all the everything for me better than where it was started. So I was in with like the top geneticists, the top oncologists, the top surgeon in the area, and they were reaching out to their colleagues at other hospitals, Johns Hopkins and MD Anderson. It was my surgeon whose friend down at MD Anderson was the one that said, do not treat this as you would treat a female, because he was still going to do a double mastectomy, but we were going to do it at a different time. So the morning of my original mastectomy on the right side is when he got the call, and so I didn't have to schedule the second mastectomy at all. So I kind of got, as where my case is, I kind of got beeline to some of the top doctors, which was kind of very nice and made the whole journey a little bit easier.
When did Oncotype DX come into the picture, and how did it contribute to the treatment decisions that you finally settled on?
So Onco came in once I was starting to meet with my oncologist. So we met with the oncologist briefly before the mastectomy, and then many times following the mastectomy, getting the plans laid out for which treatment was gonna happen. And at the time, he had mentioned about this new test that was out, and based on what my cancer was classified as, that it would be a good test to do. So we did it was the Oncotype DX test. They sent the samples off, and with all the data that they have and what they're able to compare it to and look at and run all these tests, it said that I had a 22% chance of cancer coming back over a 10-year period. But if I were to do chemotherapy, 4 rounds of chemotherapy, and the tamoxifen or Arimidex hormonal therapy for 5 years, that it would it could lower my chances of cancer coming back by almost 10%. And I was like, I still don't feel sick. I still don't have any, I don't feel like I'm a cancer patient. So it doesn't, I don't feel tired or anything. So let's do it. I was like, let's get this chemo done. And even throughout the treatments and stuff, my body, I didn't have the aches, the pains, the nausea, and a lot of the other symptoms that a lot of other cancer patients go through. I got extremely lucky. I know so many others are not. But I got very lucky in the treatments, and I never really felt horrible during them. The only thing that the side effect that kind of annoyed me the most was losing my hair. Only in instances, because I still never, even though I was going through all this, like I said, I never felt sick. But the only time that I looked at was when I lost all my hair, but I felt great still. I still had plenty of energy. I was working the entire time. I think from my diagnosis date to my last day of chemo, I missed at most 10 days of work.
Wow. How invasive was the onco as far as getting the tissue to be tested?
No, because they take the tumor itself. So they take the tumor and they're taking, they shave certain layers off the tumor, and it's on the slides. So it wasn't invasive at all. They had taken, the tumor was already out, so it was already at the pathology lab. They were already doing, it was already doing its things. It was just pretty much requesting samples of the tumor and being sent out. So the only surgery, the two that I had, the first one was removing a lump that they said was nothing, and then they tested it, and then it came back as breast cancer. And then the mastectomy, and during the mastectomy is when they also did the sentinel node biopsy test, and that showed that it didn't spread. So it was the 1 inch margins around the nipple and the breast tissue in those 1 inch margins is all that was taken out. So there was no invasiveness at all of the oncotype test.
Well, let's talk about your advocacy group, the Male Breast Cancer Coalition. Now, you're the co-founder. Is another cancer survivor in league with you?
Originally, everything started with the Bret Miller 1T Foundation. And if you want a little background on that, I've always had 1T in my name. I was born shortly after the Royals won the World Series in 1985. My mom chose to name me after Brett Saberhagen. I always yelled at her because I met many other Bretts throughout my years, especially when I was younger, and they all had 2 T's, and I always complained about it. Why did they have 2? Why did they only have 1? Well, it came full circle when I was diagnosed, and hopefully I can say this. It's not very bad. It's related to breast cancer. I've always had 1T in my name, and now I got one nipple. So the Bret Miller 1T Foundation, because I was told that the One Nipple Foundation was inappropriate. So
because you can't.
So this was my way around it. So that's where everything stemmed from. That's where it started. And we started gaining steam. We started talking and connecting with a lot of people through social media and the internet. And I will tell you, if we didn't have social media and the internet and everything like that, there's no way I would be anywhere close to where I am today. I don't even know if I would be sharing my story as much as I am. But we met up with Sherry Ambrose out of New Jersey. She is a very strong advocate about this because she had a very close friend who was diagnosed with male breast cancer and witnessed all the stereotypes and the shunning and the pushing away and saying that this is just for, we really focus on females from a lot of the breast advocacy groups up there. So he survived. I still have not been able to meet him, but she started it because of that, and she, found us, and we connected, we talked, and it's just kind of, history from there. But that's where it started. So she wasn't personally affected, or she wasn't immediately affected by it. She was because of a friend, and that's where we started, and that's where we're at today, and spreading the word and making sure that men know.
Well, where can we go online and get some more information about your coalition and about male breast cancer in general?
The malebreastcancercoalition.org. On there, we have everybody, all of our survivors' stories are up there. We have a memorandums place, a page on there as well as many other links for them to reach out outside of just us if they need more information. There's also breast self-exam videos that I did to show men how to properly do your monthly exams, because you are your own best advocate. If you find a lump, get your butt to a doctor. And if that doctor tells you it's nothing and you don't feel comfortable, go to another doctor. Don't stop until you get the answers that you're comfortable with.
Well, Bret, thank you so much for coming in. Big kudos for your awareness efforts and your Male Breast Cancer Coalition. I'm wishing you all the best, even more than you're receiving now. Thank you so much for joining us today.
Thank you very much. It was an honor.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this show are available at hpr.fm, healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in, and download at SoundCloud.